Cammie Wolf Rice, Christopher's mom, joins us now. Cammie, thank you so much for being with us today.
It's great to see you, Jay. Thank you for having me.
You know, I know you have dedicated your life to education and prevention, and we're going to be showing some of that in a few minutes. But what I would love for you to talk about now is something I think a lot of families need to hear someone address, and that is the stigma of addiction, the shame you felt because your son was addicted. And I know that you are so far beyond that now, but if you could, if you will, take me back to then, talk to me about the stigma and how it impacted you and Christopher.
You know, it's interesting you say that, Jay, because watching the documentary and the interview, when you said Christopher did the heroin, it still struck my heart. And the reason is that we've criminalized addiction in our country. And my son wasn't a criminal, you know, and to think about the language that we use when we talk about people fighting substance misuse. You know, it's a drug abuser and a drug addict. And it's a little controversial, but I totally disagree with people having to stand up every day in treatment and say, hi, my name is Christopher and I'm an addict. I mean, it just used to devastate him to have that label put upon him because it had such that negative stigma. Yes, there are criminals that fight substance misuse, absolutely. But is everyone a criminal that has an issue? No. And that's what breaks my heart, because I know that the last thing I wanted is for people to think my son was a bad person. He was loving and caring and a good human being. And we've got to start portraying people that are suffering and that are dealing with substance misuse as human beings and not in a separate segment in our society. It's heartbreaking, to be honest.
So what would your advice be to families who would find themselves in this position now of trying to help a loved one dealing with addiction?
Well, you know, I've always heard that addiction is not the casserole disease. You know, you don't tell your friends and your family and your neighbors aren't bringing over casserole that you would do if you knew somebody had cancer. And the bottom line is it does take a tribe. It does take such a strong group around you to support you through these times, and you can't be embarrassed. But the issue is nobody wants to look bad, right? Nobody wants to be thinking that they failed as a parent. You didn't fail as a parent. This is a disease. When someone's diagnosed with cancer, you don't say, well, what did you do that your child got cancer? So you have to ask yourself those questions, treat it like a disease. And the support that you can give is love, understanding, compassion, empathy, not blame, not shame, not disgust. Does that make sense?
Yeah, it makes total sense. My last question for you is one that I think we have a tendency as human beings to look back and wonder if we could have done things differently. And I know that you received an education that you never, ever wanted. But what is something that you wish you had known at the beginning of this journey?
I wish that I had questioned the doctors. You know, I don't blame doctors, honestly. I mean, I do blame Purdue Pharma. Honestly, they did kill my son, but I would have asked the doctor more questions. Why is there any dangers with these pills? I didn't even know to ask that question. We assume that prescriptions means safe, and it doesn't. And you can become addicted on one prescription. So I wish that I would ask more questions. I wish I would have paid attention to more signs that Christopher gave me, behavior changes, excessive sleeping, lashing out, just paid attention to more of the signs that he was giving me, that he was still suffering and that he was still taking the medicine because he hid it. And again, that ties back to the stigma. I think if people are more comfortable to talk about it, they're also more willing to go get help. As we now know, 1 out of 10 Americans get help with substance misuse. We've got to fix that. We've got to be open to talk about it, to get that help.
Cammie, what I love is that your story is far from over. And in a few minutes, we're going to be able to show people everything you are doing to prevent this from happening to other families. I cannot thank you enough for being with us today. It's great to see you again.
Thank you, Jay. And I'm sorry if I could just say one more word about the MAT program. Don't be afraid of getting assistance for your loved one with a medical assisted treatment. To me, it is absurd that we're even having a conversation of whether or not you should do it. If you have medicine to save someone's life, why is that even a conversation? You get chemotherapy if you have cancer. You get insulin if you're diabetic. If there is a medical assisted treatment that could save your life, why would you not do that? If I had that opportunity for Christopher, right now you might be interviewing me as one of the mothers that their child survived this and is on the other side, but you're not.
That's a very good point. Thank you for sharing that with us, Cammie. And I can't wait to show people the rest of your journey and all that you're doing shortly to come in the program.